Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello, welcome to today's presentation, Medicare, What You Need to Know, presented by Kristi Caracappa, Health Insurance Information Service Coordinator with Washington Hospital Healthcare System. Kristi has served the Washington Hospital District residents since 2009. She provides information to community members to assist them in making informed decisions regarding their healthcare coverage. Please welcome Kristi Caracappa.
Thank you, Angus, and thank you, viewers, for tuning in today for our presentation on Medicare, What You Need to Know. I'd like to start off by telling you a little bit about the Health Insurance Information Service that's provided here at Washington Hospital. It is a free and unbiased service, here to answer questions about health insurance and how to find a physician or medical center in your network. HIAS is available all year to answer any questions you have about Medicare, private insurance, or other government programs. You can make an appointment for an in-person consultation or schedule a phone appointment. Now let's get into Medicare. Our objective today is to provide an understanding about Medicare and also provide information on enrollment periods. So what is Medicare? Medicare is a federal health insurance program that provides health care insurance for the following: people who are 65 years of age and older, and people of any age with certain disabilities, also people of any age with end-stage renal failure. So who is eligible to apply for Medicare? Those who have worked in the United States for 40 quarters or 10 years, those who have paid into Medicare taxes. So you could have worked a half a year I guess a half a year here and then a quarter here, as long as it ends up to be 40 quarters. Now, how do you sign up for Medicare? There's two ways. You could either call or make an appointment for your local Social Security office, or you could go online to the Social Security website, set up an account, and log on that way. I do recommend that anybody over the age of 18 has a socialsecurity.gov login. This will help avoid Social Security fraud in the future. And it will also help you as you enter your Medicare and Social Security years to be able to access information and to make changes online. If you're already receiving Social Security benefits, you may be automatically signed up at age 65 or when you have other issues for Medicare. So when do you sign up for Medicare? I get this question quite often. There's 3 different enrollment periods. The first is the initial enrollment, when you're first eligible for Medicare. There's a special enrollment period and a general enrollment, which is January 1st through March 31st of each year for Part A and B. So we'll go over those. The first is your initial enrollment. For most people, this is when you turn 65. If you're eligible for Medicare when you turn 65, you can sign up during the 7-month period that begins 3 months before your birth month, your actual birth month, and 3 months after. So the second one is special enrollment period. This is for somebody who perhaps delayed their Medicare Part A and B. So if you turn 65 or you are eligible for Medicare, but you're still working, you or a spouse, and you're covered under a group health plan based on your current employment, you have a special enrollment period to sign up for Part A and B and avoid a Medicare Part B penalty. You can do this anytime you're still covered by the group health plan or during the 8-month period that begins the month after the employment ends. Some people will leave their employment and take COBRA. COBRA is for 18 months. You cannot have COBRA within that 8-month period. You could take COBRA, but you still need to sign up for Medicare within 8 months. If you go the full length of time of 18 months with COBRA, you may face the Part B penalty. Now, general enrollment. General enrollment is January 1st through March 31st of each year. If you missed your initial or special enrollment period, you could sign up for A and B during the general enrollment period. Your coverage will start July 1st. You may have to pay a late enrollment penalty in the form of a higher premium for your Part B. Most people do sign up for their Medicare when they're first eligible. Some choose not to because Part B does have a premium. If they feel that they won't need it or won't use it, people will delay. What could potentially happen is during the year, you will find that you need your Medicare. Now you're going to have to wait till January 1st to sign up, and it won't start till July 1st. So it's really important not to delay your Medicare if you're not covered under a group-sponsored plan. So we just went over the sign up for Medicare Part A and B, and as you see here, there's a Medicare card. You should receive that. Once you receive your Medicare card, now you have some more decisions to make. You need to think about your Medicare Part D or potentially a Medicare Part C Advantage plan. I want to go over real quick what Medicare A and B does. So Medicare A is your hospital coverage. It is your hospital coverage, and your B is your medical coverage. What that means is if you are admitted to the hospital, if you're admitted, you're put in a room, you have a bed, you have the nurses that come see you, they feed you, you have different services around you. That's the Part A hospital coverage. The Part B you still use while you're in the hospital. You need it. When your doctor comes in to see you, he's Part B. When you have medications delivered to you, even though they're medications you may have been taking at home, but the hospital is providing it, that's Part B. Any imaging, surgery, your anesthesiologist, all Part B. So it's really important for you to have that Part B medical insurance. With Part B, there is a small deductible in the $200 range, but you also have a 20% coinsurance. 20% coinsurance isn't too bad on a day-to-day basis, maybe perhaps with a physician or some small services. But if you're going into the hospital and having any large services, they could be costly. So you want to have something that covers that extra 20%. And we're going to talk about that right now. So there's two ways to take your Medicare. You've already signed up for your Medicare A and B. You have your card. Now what are we going to do? There's two ways. You could either have your original Medicare with some other parts to it, and we'll talk about that, or a Medicare Advantage plan, which is your Part C. So let's start with the original Medicare side. Original Medicare, I like to say, is driving the bus. It's your primary insurance. That's where you're going to go. You can go to any doctor or hospital in the United States that takes Medicare. Your Medicare card is going to cover that. But what about that extra 20% in your drug plan? So what you want to do is consider getting a Medigap. All right, so Medigap is supplemental insurance that fills the gaps of coverage in original Medicare. Medigap plans are sold by private insurance company, and they're lettered A through N. They're not parts, they're plans. No matter who you purchase the plan from, the coverage is the same. For example, if you chose Plan N from AARP, it's going to be the same with Blue Shield, Humana, and so on. It's the same coverage. There might be some additional benefits, but it's covering the same with your Medicare. And there is not a traditional open enrollment for Medigap plans. You could make changes to your Medigap plans around your birth month. So let's look at those plans. If you were to go to the Medicare.gov website or look at your Medicare and You book, this is a basic table that you would find. Okay, so I have some arrows over F, G, and N. Plan F is the highest plan on this table, and it's no longer sold unless you turn 65 in the year 2020. So who would be able to get that in 2022-23? Somebody who perhaps still was working and they opted to join Medicare later. They could still get that Plan F as long as they turn 65 before 2020. So really the highest plan for anybody new coming into Medicare who's just turning 65 is Plan G. The only hole in that plan, as you'll see, is the Part B deductible, which is way down at the bottom. That's around between $200 and $250. It changes yearly, but that's the most you'd have to pay. And then there's Plan N. We're not going to go too much detail, But as you age, as you get to be maybe 75, 80, and you'll find your premiums are going to go up every year, it's another choice to save money down the road. Some people opt for Plan N right away, and that's not a bad choice. But these are just my recommendations where I find that people have the best coverage. With Medicare Part D, prescription drug coverage, that's the other part of the coverage you'd want. So we have your Medicare A and B card. You've now chosen a Medigap, one of the plans, and now you need to cover your prescription medications. Even if you don't take any prescription medications, it's important to get a Part D drug plan, because during the year, if you decide that you need it, maybe something happens where all of a sudden you're taking more medications, you want to be able to have them covered. If you didn't get it originally, you're going to have to wait till open enrollment, and then it won't start till the previous year. Also, you would receive a penalty. So we'll go over this real quick. If you have your A and B with a Medigap, you may want to add that Part D drug plan. There's several plans offered by private insurance companies that are approved by Medicare. I think right now there's 26. Depending on your coverage, you may pay a monthly premium and sometimes a copayment and a deductible. These are plans that are used at the pharmacy. If you don't take the Part D coverage when you're first eligible, you may have to pay a penalty when you sign up for it during open enrollment. And that penalty stays with you for life. Okay, so we talked about that original Medicare. So with that, you have, again, I'd just like to reiterate, you have your Medicare A and B card, you have your Part D card, and now you have your supplemental coverage. What does this do? If you choose the highest plan, Plan G, the most you would have to pay for any service, any Medicare covered service, would be the deductible in the $200 range. So for the whole year, once you've met that deductible, everything's covered 100%. You could go to any hospital, any facility that accepts Medicare throughout the United States, and your services would be covered. So that's what I call the gold standard plan, because it gives you quite a variety of options nationally. So that's your original Medicare side. Tends to be a little more expensive than the Medicare Advantage side, and let's go through that now. So Medicare Advantage plans are called Part C. How do you choose a Medicare Advantage plan? You would choose it through the either the Medicare website or through a trusted broker. So the Medicare website has all the plans. I think there's 34 plans around that right now. When I started here at Washington Hospital almost 13 years ago, there were 3. So now there's 34. So they're gaining popularity. And they are available by zip code or county. But you search for them by zip code. So a little bit about Medicare Advantage plans. They're plans that are offered by private insurance companies who are approved by Medicare. That's why it's always good to go to the website, the Medicare website, to check them out. If they're there, they're approved by Medicare. You no longer use your Medicare card. You will receive a card from your Advantage plan. So you have your Medicare card, you're still paying for it, but you put it away in the drawer. The Advantage plan just gave you a new card. They must cover all the services that original Medicare covers. They're called MA plans, and they may offer extra coverage such as vision and dental. And each MA plan can charge different out-of-pocket costs and have different rules on how you get services. And these rules can change every year. So it's really important during open enrollment, if you have a Medicare Advantage plan, to review it. Make sure your doctors are still in the network. What is your premium? What is your coverage? It's good to look at that. So these are the questions you should ask when choosing a plan. You should ask your doctor and also check with the plan. What medical groups are included in that plan? You need to ask your doctor if they're in the plan, and if they are, you need to ask them what group are you with, because you want to choose the right group that goes with your doctor. And also, does it cover all of your prescription medications? What are the co-pays and co-insurance? For example, some Medicare Advantage plans have no copay when you go to the doctor. Some might have a larger copay. There's usually copays if you are hospitalized or go to the emergency room, ambulance services, and so on. So you want to look and see what all those are. You also want to look down into the meat of the plan to see if it covers things like chemotherapy, dialysis, larger items that can get costly if your health declines down the road. And what are the co-pays and co-insurance, and what are the out-of-pocket maximums? That's really important. If you're considering on choosing an Advantage plan, you always want to look, what's the maximum I would pay in this plan before it starts paying 100%? This is where you should go look at the Medicare.gov website for any of your Medicare questions. If you're welcome to call me, but you can also go to the Medicare.gov site. There's a wonderful search engine in there. It's very very easy to use, very user friendly. Just type in your question. It will take you where you want to go. So extra help. Extra help, there's actually two things, but extra help is the main one. If you are of certain lower income, you may be able to get extra help paying for your Part B premiums and your drug premiums. Also get a lower copay for some of your medications. You should contact Medicare or Social Security to find out if you qualify for extra help either through Medicare or through Medi-Cal. Real quick, the Inflation Reduction Act. I looked this up to see what's new with the Inflation Reduction Act. And I will say the Medicare site did a really good job. They'll take you to this particular, if you just type it in the search engine, it takes you to this link, and it will give you information of what's coming up in the next few years. So there is lower drug cost and improved Part D coverage. Medicare will negotiate to get you lower drug prices. They're working on that now, and better access to vaccines. What we found is some of the vaccines, for example, shingles, flu shots are pretty well covered, but shingles are covered under Part D, and you would also need to pay a deductible for that. So they can be quite costly. So they're working on improving the vaccines. Also, I didn't have a slide on it, but I want to talk about insulin. Insulin's been an ongoing problem for people to pay for, especially if they're certain low income. They have made adjustments that many of the plans are only charging $35 for your total monthly supply of insulin. And that's for a 30-day supply, and I forgot what it is for 90, but it's very low. It might be in the $45, $50 range. It does not fall into the catastrophic area or donut hole, and also the deductible does not apply. A lot of the deductibles this year are in the $500 range, and they've made a lot of adjustments to the plans to where if you're taking a lower tier medication, the deductible doesn't apply. So that's why it's really important when you're looking for a drug plan to enter all your medications into the site and look at the plans and look at how they're covering your medications, if the deductible applies or not. So scams. Health insurance companies must be licensed within the state of California, especially during open enrollment. There's lots of phone calls, flyers, and even door-to-door salesmen that come and try to find out if you're on Medicare, and they want to, they may be selling you things that aren't really plans. They're actually selling you something. They're usually, but they're kind of a Band-Aid coverage. They're not really health insurance. So you want to ask them if they are licensed with the state of California. Before you purchase a plan, ask to have information sent to you on the plan details. Don't give out your Medicare number or Social Security number if someone calls you. And beware of phone calls and mailings that you did not initiate. Also, there are lots of commercials and infomercials about Medicare Advantage plans. I just want to remind you, I watched those commercials. They're accurate. They are accurate, and they're selling real Medicare Advantage plans, the ones I've seen. You should still check them out. But just know, you're looking at one or two. There are 34. So check out all your options. And right now is Medicare Open Enrollment. It is October 15th through December 7th. And what should you look for during open enrollment? You want to look at your Part D prescription drug plan as well as your Medicare Advantage plan. What are the things you should look for? Have you had changes in your medications? Does the plan you have now still cover the current medications you're taking? And is there a new plan that could save you more money? Oftentimes, you might have a plan that the premium is affordable to you and maybe your drugs are covered well, but there might be a new plan that came in that you could save even more money. So it's always a good idea just to take a peek at it during this time. Again, open enrollment is right now. And here's my name and phone number, Kristi Caracappa. Feel free to call me for an appointment or email me with any questions you may have, and I'd be happy to answer them. And if you'd like, I can take questions right now.
Well, thank you, Kristi. We do have a couple of questions. One person writes in, I have Medicare and recently moved from Utah to Newark. Do I need to make any changes in my Medicare Advantage plan?
Yes, I'm glad you asked, because Medicare Advantage plans are sold by area. So I'm pretty sure something in Utah is going to be different here. Even though it might be the same company, the coverage might be different, and usually they'll request you to change your plan. And it could be, if you're in a Humana plan, there might be another Humana plan here. But this is also your opportunity to make changes to your Medicare plan mid-year. You don't have to wait till open enrollment. If you're making a move out of a service area, you could make changes by either dropping your Advantage plan and picking up a Medigap and drug plan, or you can choose a new Medicare Advantage plan that might work better for you in your new location.
Thanks. Another question we have is from somebody who says, I have a Medigap plan and a Medicare Part D plan, and my premiums go up every year. What's the best way to evaluate my plan?
Great. Yes. So what you'll find with Medigap plans, typically they do go up every year. You'll find what you're paid when you're 65 is probably not going to be the same that you paid when you turn 70. So Medigap plans are usually evaluated during your birth month. There's sometimes during the year plans will open up and allow you to make changes on Medigaps, but the ideal time is to look during your birth month. I always like to say, check with a trusted broker, a trusted friend, to see who can give you different prices on plans. So you might change the company, you might change the plan you're on and stay with the same company. So you should evaluate that every year. For your drug plan, you can only do that during Medicare open enrollment unless you've moved out of the service area. Otherwise, this is the time to look at your Medicare Part D plan, and oftentimes you can save money either on your premium or your copays during this time.
Somebody else writes in, how do I know what doctors are in my network?
Good question. I get that call all the time. It's really best if you have, first of all, if you have a Medigap plan, it's very easy. You just call the doctors that you want to see and see if they're taking Medicare. Most doctors take Medicare. If they do, then your supplement follows. You don't have to let them know about your supplement. Not because it's a secret, just because it can be confusing. Just ask, do you take Medicare? Straight Medicare A and B? If they say yes, the supplement immediately follows. So that's an easy one. A Medicare Advantage plan, I recommend you either go to the Advantage Plans website and enter your doctor's name, or find a doctor if you don't already have one, and they'll give you a list of doctors. Once you find doctors that you think you might want to use to make an appointment with, go ahead and call them and just confirm that they're still taking new patients and that they are in network with your current plan.
Well, thanks, Kristi. We have no more questions. So this concludes our program. Thank you for providing this information, Kristi. And thank you, viewers, for tuning in into the entire broadcast of today's presentation. The presentation will be available on our Facebook page and on YouTube, our YouTube channel as well. Thank you so much. Bye-bye.